Hi, my name is Charlotte. I'm a dental hygienist and I'm about to lose my mind. Why? Because every single day I have stress over medical histories. Our office only requires a medical history every 3 years, and then we can update on the existing form in between. But every day, someone that walks into the office doesn't want to do their paperwork. They either scoff, question it, refuse to do it, write the word same on every single section of the medical history, or write nothing's changed, or just don't check the yeses and nos. They don't sign the back, you know what. But I gotta be honest, when I came home yesterday, I wrote a blog post on my website because I understand there's a lower perceived value on the paperwork for people that don't want to do it. I think truly if they understood the reasoning behind it, that they would volunteer that information and want it to be accurate as possible. I'm gonna sum it up like this. The medical history, the reason why we do that is so that we can get a hold of you, so that we can get payment from the insurance companies, and most importantly, so that we don't kill you. I'm not being dramatic. The reason why we need accurate information on a medical history is so that you are better off when you leave than when you came in. We don't want a medical emergency. I don't ever want to have someone pass out because they've got uncontrolled diabetes and EMS has to come in and they're asking me, you know, what's up with this person's medical history, and I don't know. The patient didn't write it down, and then all of a sudden, who's responsible? Even if it's not my fault per se, someone passed out in the office, and all of that could have been avoided had I known what was going on with them. So these are the kind of things we're thinking about. We're not trying to bother people. We know it's extra paperwork. We know it takes a few minutes. But I'm going to give you, okay, as much as during my daytime, I try to be professional. I very rarely, I might get a little snarky with people if they give me attitude, but I very rarely would talk like this. But I'm going to be honest. When someone says nothing's changed on their medical history, really 7 to 8 times out of 10, something on that medical history has changed. And it's important to have that information on paper. The other thing that people like to tell me is that it has nothing to do with their teeth. Your mouth is a pathway to the rest of your body. Everything's connected. The medications that you take can cause side effects in your mouth. Lumps and bumps and ulcers, recession, dry mouth, you know, all these things we're looking at when we see you, and we're trying to correlate it with something that's going on in your medical well-being. We're just trying to be good caregivers. That's it. We're not trying to bother you. It just should not be such a stressful situation. Oftentimes people don't have a list of their medications, and they'll tell me almost every time they come in, oh, I don't know, I take something for my blood pressure. But please do yourself a favor. This is going to simplify everything. On a little piece of paper in your cell phone, put it in your wallet or your purse or whatnot, write your name, write your date of birth, write any allergies that you have, write your medications that you take, any major surgeries that you have, and any medical conditions that you have. You don't have to remember squat. If it's on that little piece of paper and you just tuck it away somewhere so that it's always on you, it makes this so simple. And then here's the nice thing. If you don't give the front desk attitude, then they feel fine. If you don't give the hygienist attitude, then they feel good. People that are going to come at you with sharp tools, don't you think you want them to be in a good mood? Don't you think you should do everything to be cooperative? Honestly, if someone's going to take blood, I'll bring them a cookie or a piece of candy because I want them to be happy while they're getting ready to poke me. Like, just think it through. We're human beings and we have jobs to do, but more importantly, the job that we do is based on critical information that we need to gather to be good caregivers to you. Okay. I think that's it. I feel better. I vented just a little bit. I would love to hear from my colleagues out there. I have suggested in the past that maybe patients could be told ahead of time that they need to update their medical history, because we do have the forms on our website. I think that would help. What other ideas do you have? Do you just tell everybody every time that they need to come in and do new paperwork? Do you just ask for them to come in early, or like, what do you suggest? Because I'm getting really frustrated. If you're frustrated too, I'd love to hear from you. And you know what? If you're not in the medical field and you've refused to fill out a form at some point, can you just tell me why? Was it because you were annoyed, it was a long day, you can't read or write really well, you feel like it was redundant? Did you think it was being too personal? Like, I want an honest conversation, so that I can get a little more perspective on this. And because, over time I am losing my patience a little bit. I'm gonna try. I'm gonna go back to work and I'm gonna have a better attitude. But chime in. I'd love to hear from you.